So are you eligible for Medicare and confused about options for coverage? Still working with employee coverage and wondering if you should sign up or have time or have trouble affording Medicare costs? Today, Simon Manrique and Melinda Gardner are here. Simon is a benefits counselor from the Area Agency on Aging and will cover the basics of Medicare and government programs that help with Medicare costs. At this time, I would like to welcome Simon to speak to you about Medicare 101. Simon?
Hello, everyone. How y'all doing? I need to apologize to begin with because my voice allergies are acting up like crazy, and they're doing their thing. But we will give this a shot either way. And again, yes, my name is Simon. I'm a benefits counselor too with the Area Agency on Aging. The name of our company is the North Central Texas Council of Governments, where our office is located here in Arlington. And as a matter of fact, we're kind of catty corner across the street from Six Flags. And so, yes, again, my name's Simon, and I'll be presenting today's Medicare 101 class, okay?
Simon, you may need to reshare your screen.
Oh, do I?
I'm not
Okay,
seeing
no
it.
problem. I can do that.
Thank you.
Okay, looks like did you get it? Is it cool?
You're good.
All right, fantastic. All right, again, I want to welcome everyone, the Plano Public Library, and I want to thank you so much for attending. Now, to begin with, I do need to let you know where I'm going to go. This is a slide presentation that we utilize here at the Area Agency on Aging, and we utilize it for different areas. So some areas do allocate more time than others, and so some it's less time. And usually what we do is I go in through and eliminate some of the, or not eliminate, but skip over some of the information so that it doesn't last that long to what I'm going to be talking about and presenting to you all. And again, just thank you for attending, and I'm going to get started with this. And yeah, the first thing is getting started with Medicare. Several of you coming into Medicare or either have already been on Medicare, and you're needing to know or wanting to know what your options are available. And that's part of the big job that we do here at the Area Agency on Aging. We like to let individuals know what their options are with Medicare, and sometimes some of the other different programs that are available with Medicare, such as Medicaid, little things like that. And then there's other different little benefits that sometimes are available with Medicare that you're able to utilize. So again, here we're going to get going with this. Again, what's Medicare? Medicare is health insurance for individuals that are 65 or older, certain people who, and also certain people who are under the age of 65 with disabilities. Some individuals are disabled and are under the age of 65, and do qualify for Medicaid because of their disability. There's also individuals of any age with end-stage renal disease, which is the permanent kidney failure, requiring dialysis or even a kidney transplant. What agencies are responsible for Medicare to begin with? Social Security. A lot of individuals call us and they ask us, who do we call so that we can enroll into Medicare? One of the first things that we always tell them, you need to call Social Security. Social Security enrolls most people into Medicare. Then there's also individuals with a railroad retirement board, these individuals that are worked with the retirement, with the railroad retirement, are worked with the railroad and are going into retirement can call the Railroad Retirement Board or even Medicare. There's also the Office of Personnel Management, which handles the federal retirees premiums, and of course, CMS, which is the Center for Medicare and Medicaid Services. What are the parts of Medicare? Medicare basically has two parts, and then there is an additional third part. The first two falls under what's called original Medicare. Original Medicare consists of, again, two parts. Part A as an apple, and Part B as in boy. Part A covers your hospital services. Part B covers basically your doctors and their services. And then once you're on original Medicare, then Medicare kind of requires you also to have what they call credible prescription drug coverage, and that's going to be your Part D as in drugs, and that'll be your drug
Simon?
coverage. Sorry,
Simon,
yes.
I apologize. Would you try sharing your screen again? So we're not quite seeing that PowerPoint.
Oh, okay, because I can see it. I don't know. I'm
Okay.
not sure why. I can see it.
I see in
But
the
yeah, go ahead.
Q&A.
Yeah, somebody is saying they can't see it. So go
And-
ahead and
Someone-
unshare, and then reshare.
Stop sharing.
Mm-hmm.
And try it one more time.
Thank you. Sorry about that, Sharon.
It's okay.
Okay, so
How's that?
is everyone able to see it now?
It's good now.
Okay, you can see it. Okay. Let's see.
Let me know when y'all are ready.
Okay, it's
Let me know. No problem.
okay. If our attendees are able to see, could you raise your hand, please? So we know you're able to see the PowerPoint. Okay. Thank you. Thank you. Thank you. All right, we're good to go, Simon.
Awesome. Again, these are the parts to Medicare. Part A covers your hospital services. Part B, which covers your doctors and their services. And then again, because you're on original Medicare, which is Part A and Part B, Medicare requires you to have, again, credible prescription drug coverage. And that's going to be your Part D for drug coverage. Well, these are the different ways that you can get the Medicare coverage. Okay? 'Cause remember, Medicare is your medical health insurance. Okay, so with Medicare, like I was saying, original Medicare, which consists of Part A and Part B, and then depending on how you're going to go about your coverage, you can add Part D, as in drugs, and Medicare also offers what's called the Medigap policies, also referred to as supplemental coverage. And I'll go into a little bit more detail into the supplemental coverage insurance, which again is also referred to as Medigap. Okay. And of course, that's one way of getting coverage. The other way of getting coverage is the Medicare Advantage plans, which is also referred to Part C as in cat. But Medicare Advantage covers your Part A, your Part B. Most plans also include Part D because there are some Medicare Advantage plans out there without prescription drug coverage. Why you would want to get into a Medicare Advantage plan without prescription drug coverage, I'm not too sure why somebody would do that when it's added on there already. There's not an additional cost for having that coverage like you would when you're on original Medicare and a standalone prescription drug plan. But the Medicare Advantage plan does include Part D. Plus, it also offers some extra benefits, and I'll go a little bit more into those extra benefits also, okay? Okay, original Medicare versus Medicare Advantage plan as far as doctors and hospital choices. With Medicare, original Medicare, you can go with any doctor or hospital that takes Medicare anywhere across the United States. Whereas with the Medicare Advantage plan, these Medicare Advantage plans, what has happened, Medicare has subcontracted with several private or commercial insurances. And I'm not trying to be biased to any particular insurance, but just to give you an example of some of the different insurance companies that are out there, just to give you an example, such as Cigna, Aetna, Humana, United Healthcare, Blue Cross Blue Shield, just to name a few. There are other insurance companies out there, but in many cases, you can only use doctors and or other providers who are in the plan's network and service area, meaning you all are in, most of you are probably Collin County. And if you're in Collin County, then your plan is going to be specific, usually to doctors that are in that area, okay? So that's why with the Medicare Advantage plans, it indicates that you can only use doctors and other providers who are in the plan's network and service area. And then as far as original Medicare, in most cases, you don't need a referral to go to see a specialist with original Medicare. On the other side, with the Medicare Advantage plans, you may need to get a referral to use a specialist or your particular specialist. Other things for Part B covered services, you usually pay 20% of the Medicare approved amount after you meet your deductible. This year, there was a Part B annual deductible of $240. And then after you met your Part B annual deductible, then of course, that's where Medicare starts paying their 80% and you pay your 20%. Versus on the other side with the Medicare Advantage plan, you can see there's an out-of-pocket cost limit that the different insurances have. So meaning there's only so much amount that you're going to be, a lot of these out-of-pocket amounts start around $3,000, sometimes a little bit lower, sometimes a little bit higher, depending on what you get, because they're with the Medicare Advantage plans, they offer HMO plans, which is the Health Managed Care Organization type of plan. And then there's the PPOs, which is the preferred provider organizations, where with a PPO, you can almost go to any doctor you want, as long as that particular doctor that you want, that's in your area, accepts your particular plan. So you need to be very careful with that. Okay. With original Medicare, you pay a monthly premium for Part B. Anybody and everybody that's in Medicare and with original Medicare and you're enrolled in Part B, more than likely you will have to pay a Part B premium. This year, we don't know what it's going to be for 2025 yet, but I can tell you for 2024, this year, the Part B monthly premium was $174.70. With the Medicare Advantage plans, usually you have to be Part A and Part B, and you're going to be still susceptible to the Part B premium with the Medicare Advantage plan. So you're still going to wind up paying the $174.70. So where it causes some confusion is that a lot of commercials and a lot of the mail information that you get, even some brochures that individuals get with the Medicare Advantage plans, they indicate that there is no premium. But basically, you're still having to pay a premium because you're still paying that $174 for the Medicare Part B premium. So you're still going to have to pay that. Okay. So just be aware that when they tell you there's no premium, there's no additional premium when you go with the Medicare Advantage plan versus just going with the original Medicare, because you're still going to have to pay that $174.70 to go with Part B. One thing with original Medicare, there are no yearly limits on what you pay out of pocket unless you have supplemental coverage, like the Medicare supplement insurance again, which is the Medigap policies. And then with the Medicare Advantage plans, you will have a yearly limit. And again, that yearly limit is usually around 3,400 up to 4,000, up to $5,000 out of pocket maximum that you'll wind up paying. And then, of course, once you meet your out of pocket maximum, then the private insurance will take over your cost. The Medigap policies, just to give you an example, the Medigap policies, what they do is they pay the 20% that you're responsible when you're on original Medicare. Because remember, like I said, on original Medicare, Medicare pays 80%, and the client is responsible for 20%. And that's what the Medigap policies cover. Generally, they cover that 20% that you are responsible for. And that's only with original Medicare. So if you're on original Medicare A and B, the standalone prescription drug plan, which is the Part D, then you can go ahead and take advantage of the Medigap policies, okay? If you're on a Medicare Advantage plan, then the sales reps should not be, the sales agents should not be selling you into a Medigap policy because you're not going to be on original Medicare with them. You're going to be on a Medicare Advantage plan with them, okay? So they shouldn't be selling you one. If they do, they shouldn't be doing that. That's all. They're going to be taking advantage of you if they do decide to sell you one. This slide, there's a lot of pretty much some of the information that already ended. And again, just to give you an idea, I'm gonna the main thing up here is the first one. Original Medicare covers most medically necessary services and supplies in hospitals, doctor's office, and other healthcare facilities. Original Medicare doesn't cover some benefits like eye exam, most dental care, and the routine exam. Now, with the Medicare Advantage plans, you'll see the commercials that they indicate that they cover dental, vision, hearing, but it doesn't cover extensive coverage. Like a lot of the Medicare Advantage plans, usually what they cover is the office visit, a teeth cleaning, and it's a basic teeth cleaning at that. Usually they cover about 3 x-rays at the most. And then a lot of times they cover a fluoride treatment. That as far as extractions, fillings, implants, the extensive work, they do not cover that. Now they'll tell you you can go ahead and get it if you want. You can do that. But ultimately you're going to be responsible for that. So you need to be very careful with the Medicare Advantage plans as far as dental, vision, hearing as to what they cover and they don't cover. And again, it can vary from plan to plan, from insurance company to insurance company. So be very careful with that. Original Medicare generally doesn't cover medical care outside of the United States, but you may be able to buy Medicare supplement insurance, Medigap policies that covers emergency care, what is usually referred to as worldwide emergency care, through the Medigap plan. The Medicare Advantage plans, they generally don't cover medical care outside of the United States. Some plans may offer, again, a supplement benefit, and it's usually the emergency room services, worldwide emergency room services. To give you a little bit better of an explanation, if you go out of the country, out of the United States, and you go to another country outside of the United States, usually what the insurance company will want you to do, they'll want you to go to an emergency room where they can help you with the cost, versus if you went outside of the country and you went to a particular doctor's office, then the probability of them paying any portion of that is nullified. They may not pay any portion of that. Whereas if you go to an emergency room, yes, there is more of a probability that they would help you pay for that, okay? So sometimes individuals are automatically enrolled into Medicare Part A and Part B. enrollment is automatic for people who get Social Security or Railroad Board benefits already, are under the age of 65 and have a disability and getting disability benefits from Social Security for a certain disability for 24 months. Some individuals, like sometimes we get individuals that are call us and tell us, "Hey, all of a sudden I qualify for Medicare and I don't understand why." And a lot of times it's because of that. They're on a disability and they've been on it for at least 24 months. And after the 24 months, you'll get some information in the mail, usually notifying you that you qualify for Medicare. And those are the individuals that may be automatically enrolled into Medicare. So if you're going to be eligible for Medicare, look for your Get Ready for Medicare package. Usually it's mailed to you 3 months before your 65th birthday. And so if your birthday's in July, what is it, April, May, June? Yeah. So during April, May, and June, you may get your Get Ready for Medicare package because your birthday's in the month of July.
Hi, Simon.
Yes, ma'am.
Could you explain, there is a question, what RR and B stands for again?
What?
RRB?
That's the Railroad Retirement Board.
Gotcha. One more question. Can you change your Medicare plan or you only have one chance to select it?
I'm going to get into that in a little bit.
Very good.
There are options, but it just depends on what your situation is. But yes, you can change it, but again, it depends on what you say. And I'll get into that here in a little bit also, okay?
Thank you.
Yeah, okay. Some people must take action to sign up into Medicare, and you can apply to Medicare 3 months before the month of your birthday. And you can call Social Security to enroll into Medicare if you're ready to go. Okay, you can call Social Security, or you can go to the SSA.gov website, and you can also get the necessary information there to enroll into Medicare. A lot of individuals call and say, "Hey, I'm calling Medicare and I want to enroll into Medicare." And a lot of times that's where we have to tell you, no, you need to call Social Security to enroll into Medicare. You can call Medicare and Medicare will notify you what the process is, but still, you should be calling Social Security to enroll into Medicare. And like I said, and you can do it 3 months before the month of your birthday. Then here is what the RRB stands for, Railroad Retirement Board. If you're retired from a railroad, okay, you can contact your Railroad Retirement Board at this number, and you can enroll into Medicare through them too. Once you're enrolled into Medicare, you're going to get this beautiful red, white, and blue card. It's going to have your name on it. It's going to have your Medicare ID number on it. And then you're going to see, like this one, it says Hospital Part A and Hospital Part B. And if you notice, after the Part A and the Part B, there is an effective date. And it's going to be the month. And it's always the first day of the month of your birthday. And of course, again, here it says 2016, but again, it just depends on the year that you enrolled. But yeah, it is the first day of the month of your birthday, regardless of what day of the month your birthday is. Medicare will start on the first day of the month of your birthday is usually when it gets started. Okay. Again, this it's going to list the Medicare Part A shown as hospital, Part B shown as medical, and it's along with the date of when your coverage is going to begin. To accept Part B, you got to keep your card and carry it with you whenever you're away from home, because again, it is your insurance card. There is an option that you can refuse Part B if you like, and I'm going to go into a little bit more extensive where you can refuse to have Part B coverage. And again, I'm going to explain that a little bit more. If you get your card and for some you know, you never know. Things happen. You may lose your card. You can always get a replacement card by going to the Medicare.gov website, which you can set up an account with your own particular username and password, and you can go in and you can request a replacement card there, or you can also call Medicare at 1-800-Medicare, and you can also ask them to send you a card, and they will send you a replacement card if you lose it. Okay, things happen, like I said. So yeah, do know it's an option. When to sign up or make changes to your Medicare coverage. If you don't already have Medicare, you come into Medicare, there's basically 3 different periods when you can get into it. You're going to have your initial enrollment period, which is when your birthday is on the particular month, and you have the 3 months before, and you have the 3 months after. That's going to be your initial enrollment period. And then there's special enrollment periods that you can enroll. So let's say you move from one county to another county, or you moved from one state to another state. And there's, again, it depends on your coverage. You will have a special enrollment period to enroll into a different Medicare program. But these are some of the periods that you have available to you. Then there's the general enrollment period. That one is particularly for Medicare Advantage plans. And I'll go into that here in just a bit also, so you'll know how that works. If you already have Medicare and you want to change how you get your coverage, again, you have an enrollment period, which is what's coming up here in next month, which is October the 15th through December the 7th. There's the Medicare Advantage open enrollment period. That is from January the 1st to March the 31st. And again, I'm going to get into that. And then there's also open enrollment period for institutionalized individuals. And yeah, depending on your situation, if you were in an institution and you're coming out of the institution, well, you have an enrollment period also. And then there's the special enrollment period that I was talking about, which is that second one earlier, the SEP, the special enrollment period. But again, it depends in certain circumstances. Again, it depends on the type of coverage that you have. Your initial enrollment period, again, is 7 months. And again, it's going to be 3 months before the month of your birthday. You have the actual month of your birthday. And again, it doesn't matter what day of the month your birthday is, okay? And then if need be, you have 3 months after the month of your birthday to also enroll into Medicare. If you sign up for Part A and a Part B before you turn 65, your coverage, again, like I mentioned there, your coverage will start on the first day of the month of your birthday. That's when it's going to start. Again, regardless of the day of your birthday. If you sign up the month of your birthday when you turn 65 or during the last 3 months of your initial enrollment period, your coverage begins the first day of the month after you sign up. Let's say your birthday was this month of September, and you enrolled sometime during this month. Then your coverage will start on the first day of October. That's when your coverage will start. Again, if you're under the age of 65 and have a disability, which is because that's how you can qualify for Medicare. If you're under 65 and have a disability, again, you'll automatically get Part A and Part B after getting 24 months of disability benefits. Special enrollment periods. These starts after the Medicare initial enrollment period that you've already gone through, or if you have a general a group health plan through an employer. Okay, this is a special enrollment. Group health plan usually has to do with when you're employed, when you're employed and you have coverage through your employer and you're fixing to retire, that's going to be your group health insurance. Or you can even have coverage through your spouse if your spouse is working and he or she has you on their employer group health plan. Okay. Again, this continues for 8 months after you get out of your group health plan insurance coverage, either if it's your own employer group health plan or your spouse's group health plan coverage. Okay, so you have 8 months to enroll into Medicare at that point. General enrollment period. The general enrollment period each year starts on January the 1st and it goes all the way to March the 31st. Okay. Yeah. 3 months. Usually this is applied for your Medicare Advantage plans. Now, again, like it says here, you can sign up for Part A if you have to buy it. Part A, and the reason it says if you have to buy it, because originally or regularly with Part A, if you worked at least 10 years of your life and you accumulated the necessary 40 credits, Social Security with the necessary 40 credits, your Social Security, you qualify for Part A for it to be free. Again, but you have to have the 40 necessary credits, your Social Security, so that Part A is free and you won't have to pay. But there's sometimes individuals that didn't work enough to get the 40 credits, and if you didn't, then you're going to have to pay, or you're going to have a Part A monthly premium along with your Part B monthly premium. And that's why on Part A it says if you have to buy it, you're going to have that. Part D, as in drugs, when you sign up for Part B, you're going to need to have some sort of prescription drug coverage. And that's what that's talking about right there. If you don't enroll into one of these during your general enrollment period, the initial enrollment period, and you go a certain amount of time without coverage, you may be imposed what's called a late enrollment penalty. And I'm going to go into that a little bit more, but you can see it mentioned, it's there. You may have a late enrollment penalty, and I'll go into that also here a little bit more. The yearly open enrollment period for people with Medicare is 7 weeks. Again, this is open enrollment period, which is what's coming up. Again, it starts on October the 15th every year, and it ends on December 7th. Now, during this time, you can call Medicare and request a change, or you can even call us. We are your area agency on aging. I'll give you our phone number. I'll be giving you our phone number and how you can get a hold of us also. And we can help you during this time to let you know what options are available for you. Again, you can, if you're already in Medicare, and let's say you're on original Medicare with the standalone prescription drug plan, and then you decide you want to go with the Medicare Advantage plan, at this time you can choose to make the change, but the change is not going to take effect until January the 1st. And then vice versa. Let's say you're on a Medicare Advantage plan with a particular insurance company, and you don't want to be on the Medicare Advantage plan anymore, and you want to switch back to original Medicare with the standalone prescription drug plan. You can request that change at this time. And then, so what will happen is your Medicare Advantage plan coverage will end at the end of the year. And then come January 1st, it'll switch you over to original Medicare with the standalone prescription drug plan. And also your prescription drug plan will start at that time also. Again, as you can see, coverage begins on January the 1st. The Medicare Advantage open enrollment period, again, is from January 1st through March the 31st. So let's say you decided you were on original Medicare last year, okay? And you during open enrollment, October the 15th through December the 7th, you decided to switch over to a Medicare Advantage plan. And the Medicare Advantage plan with prescription drug coverage becomes effective on January the 1st because it's a new year and you're starting the new coverage. You go to the doctor on January the 29th and you find out that maybe your doctor does not accept the particular plan that you chose, or that particular plan doesn't cover some of the services that you need, or you get a prescription for a particular drug and that particular plan, that insurance company doesn't cover that particular medication. Well, guess what? You have until March the 31st to change to another Medicare Advantage plan or go back to original Medicare with the standalone prescription drug plan. But you have to do that by March the 31st. And that's how it is every year, okay? And that is the Medicare Advantage open enrollment period, okay? That's just basically the same thing where that you have the first 3 months to switch back from an original a Medicare Advantage plan. And this is only for Medicare Advantage plan. This is not if you're on original Medicare wanting to switch over to a Medicare Advantage plan. Okay. Again, switching over to another Medicare Advantage plan with or without prescription drug coverage, or you can drop the Medicare Advantage plan and return to original Medicare. Special enrollment periods, and this is exceptional situations. People may qualify for one of the SEPs, which is special enrollment periods, if they're impacted by an emergency or disaster. They were formerly incarcerated. They get inaccurate or misleading information from their health plan or employer, or if they lose Medicaid. If you didn't know, you can have Medicare and Medicaid at the same time. And if you have Medicare and Medicaid at the same time, depending on your situation, you may qualify for certain Medicare Advantage plans, which are called special needs plans, which also means what they call dual complete plans. Dual complete because you have dual coverage, Medicare and Medicaid. If you lose your Medicaid and you're in a special needs plan or in a dual complete plan, if you lose your Medicaid coverage, you're not going to be able to be in a dual complete or a special needs plan. You're going to have to come out of that plan, and you'll have to go over to a Medicare Advantage plan or back to original Medicare with the standalone prescription drug plan. And again, it just depends on what your situation is. And as it says, you'll have 2 months to join a Medicare Advantage plan with or without prescription drug, or a Medicare drug Part D plan, and then again, the same thing here. Once you switch, your coverage will start on the first day of the month after your plan request gets approved. Okay. Okay, so again, Medicare Advantage and Part D, a special enrollment periods. If you have a special enrollment period, if you move out of your plan service area, that'll cause you to change plans. If you have Medicaid and Medicare or qualify for a low income subsidy, you can change plans at that point too. And if you are in a plan that leaves Medicare or reduces its service area, because sometimes, again, the plans cover, usually it's your zip code area, and sometimes it's a little bit more than one particular zip code. If you move from one zip code to another zip code, that'll also cause you to change plans, okay? If you leave or lose your employer or union coverage, again, your employer, if you lose your employer coverage, that's going to be a special enrollment period. You'll be able to go back, you enroll into original Medicare with a standalone prescription drug plan, or go with a Medicare Advantage plan with prescription drug coverage. Some of the Medicare Advantage plans with prescription drug coverage have what they call star ratings, and the highest rating that you can get with those stars that indicate the type of customer service that these plans offer. If it's a 5-star plan, and let's say you're enrolled into a 4-star plan, and then all of a sudden you see that a particular plan is a 5-star plan, well, you can request to switch over to a 5-star plan. That'll count as a special enrollment period, and you can switch over to that 5-star plan. And if you are sent a retroactive notice of Medicare entitlement, I'll get into that a little bit more here in just a bit, okay? Original Medicare. Again, remember I was telling you there's basically 2 ways of getting the coverage. Original Medicare, A and B, with the standalone prescription drug plan. And if you can afford the Medigap policy, the supplement plan, that's going to be basically your third option. But usually individuals just go with original Medicare, A and B, and the standalone prescription drug plan that way. The other way, again, of getting coverage is going to be with your Medicare Advantage plans with prescription drug coverage. But also, I need to let you know, there are some Medicare Advantage plans without prescription drug coverage, but the majority of the Medicare Advantage plans do offer the prescription drug coverage. But right now, this is original Medicare with Part A and Part B. Part A, again, covers your hospital insurance, and it covers your inpatient care in a hospital, including semi-private room services, meals, general nursing, drugs, including methadone to treat an opioid use disorder. It also covers other hospital services and supplies. Inpatient care in a skilled nursing facility is also covered after a related 3-day inpatient hospital stay. So in order to qualify for that skilled nursing facility, you would need to be in the inpatient in the hospital for at least 3 days. Other things that Part A covers, blood, like the blood, if you need blood as an inpatient. Part A also covers hospice care. It offers some health services, not all of them. So you need to be careful with what kind of services you need and find out what kind of home health services they offer. And then they also offer inpatient care in a religious, non-medical healthcare institute. And there's going to be some additional information with that also. Again, like I was telling you earlier, most people don't pay a monthly Part A premium. And the reason for that is because of this. If you and your spouse, or your spouse rather, pay FICA taxes for at least 10 years, if you worked at least 10 years of your life, okay, you get Part A without having to pay a Part A premium, and you're going to get Part A free, okay? You may have to pay a penalty if you don't sign up when you first became eligible for Part A, if you have to buy it. Again, these are individuals that didn't have enough credits, that maybe didn't work 10 years of their life, and they get enough credits, then you will have the monthly premium for Part A. And it says here, your monthly premium, the penalty-wise, your monthly premium may go up 10%, and you'll have to pay the higher premium for twice the number of years you could have to pay for Part A, but didn't sign up for Part A. So you have to be very careful. Where I've seen this happen more than often than not is with Part B. Some individuals get Part A because it's free, so they don't have to pay for it, and then they enroll for Part B, and like this year it was $174.70, and they were like, "Oh my goodness, that's too much. I don't know if I'm going to be able to cover all of that. So they don't get Part B. And then all of a sudden they go into a hospital, something happens, they need more coverage, they need to have doctor coverage, medical coverage, and then they have to enroll into Part B. They enroll into Part B, let it be maybe 2-3 years without Part B, and then they're going to be penalized. And with Medicare, if ever you get penalized for something like this, you're penalized for the rest of your life, regardless. So, as an example, I had an individual that was penalized because they went 3 years without Part B, and they went 3 years without prescription drug coverage because they were in good health. They didn't need it, but all of a sudden something happened 3 years down the road. So they enrolled into Part B. They enrolled into the Medicare prescription drug coverage plan, the standalone plan, and then they got a penalty. It was a particular insurance, so that particular insurance started charging them for the penalty, and they were like, "What?" So this individual decided to get out of this particular insurance and went with another insurance, and guess what? That other insurance also started billing them the penalty. What they didn't realize is the penalty basically is imposed by Medicare, and Medicare dictates to whichever insurance company you're with to bill you that penalty. So there's no way out of it. Individuals are like, can I pay extra to get out of it? Is there anything I can do? Can I jump through hoops to get rid of it? No. Medicare, once they impose that penalty, you're stuck with it. Okay. So you need to be careful with it. And again, as far as when you have to enroll to Part A, Part B, be sure and do it accordingly. Okay. Part A, again, it's free to most people. And if you don't have the credit, you can pay for it. And if you're not sure you can call your benefits administrator with your husband's work to see if there's something that can be done. If you don't have enough, again, it's the credit that you need to have. I know also sometimes the employers didn't correct the information. Your husband worked for 10 years, you worked for more than 10 years, and the government, the Social Security didn't get the right information. Call your employer, your former employers, and check to the human resources individuals so that they can get the information corrected for you. So that way you don't have to pay the penalty. Okay. Medicare Part B, medical insurance. These services cover your doctor services, outpatient medical, surgical services, and supplies. They cover like clinical lab tests, diabetic testing, equipment and supplies, preventative services, home health services, outpatient mental health care services, and some prescription drugs. Not all of them, okay? So you need to be careful. Depending on the type of prescription drug that you need, you need to be sure that your doctor explains this to you so that you're not responsible for it. Preventative services. There's an extensive list of preventative services. Again, alcohol misuse, screening, counseling. A lot of the preventative services are services that we need, like, from year to year exams. There's some that the males need to take. There's several that females need to take services. And again, the preventative services for diabetes, flu shots, glaucoma, hepatitis, the mammograms, even obesity, behavior therapy, prostate cancer for the men. There's a lot of things. And then one of the services that I do like a lot of this is the Welcome to Medicare preventative service, preventative visit. Once you come into Medicare, there is a Welcome to Medicare preventative service. Your doctor, you can talk to your doctor about it, and your doctor schedule it with you, where all of those services are covered, and you don't pay anything for your Welcome to Medicare. And again, there it is, your yearly wellness visits. Again, the different tests that we need from year to year to make sure we're doing good. Okay. What's not covered by Part A and Part B? some of the items and services that Part A and Part B do not cover. Eye exams are not covered by Medicare. Part A will be long-term care, cosmetic surgery. You want to get rid of the eye bags under your eyes, and they consider that a cosmetic surgery a lot of times. So they move to, again, it needs to be medically necessary. It's what it's going to boil down to. Your doctor needs to demonstrate that any procedures, any services that you need are medically necessary. Massage therapy is not covered. Routine physical exams are not covered. Hearing aids and exams for the fitting of the hearing aids is not covered. Dental, most of your dental services are not covered. The only time dental services are covered by Medicare, if you're like in an accident, a car accident, so to speak, and you let's say you hit the steering wheel, or you hit something during the accident and it knocked your teeth out, so you need to get dental care for that. That's been the only time that I know where Medicare has covered something because of an accident that you had and you broke your teeth, or you had this real bad fall and you fell head first or face first and you broke your teeth. That's been the only time where I've seen Medicare sometimes will cover it. But again, it depends on your doctor, and your doctor needs to prove that it's medically necessary. Okay. And again, they may be covered if you have other coverage like Medicaid or with a Medicare Advantage plan that covers some of these services. Because remember, Medicare Advantage plans do cover dental, vision, hearing. Oh, let me rephrase that. Basic dental, vision, and hearing. Okay. What do you pay for 2024 Part B monthly premium? Again, this year, 2024, it was the standard premium was $174.70. We do not know yet what it's going to be for 2025. Sometime next month, we should have an idea what it's going to be. Usually they'll let you know. If they don't, a lot of times you can just call us, and if we have the information, we'll let you know. But usually we find out sometime in October. And some people who get Social Security benefits pay less due to the statutory harmless provision. That's a little unusual, but again, as far as not paying that monthly premium, Part B premium, there are programs available out there for individuals that will help you pay for that. Okay, and a lot of those services are through Medicaid, or Health and Human Services. There are programs out there that will help you pay for that. Since your premium may be higher if you don't choose Part B again, and you become eligible, or you become for a penalty, or sometimes if your income is a little bit higher than usual, or what a lot of individuals make a certain amount with Medicare. But if you're one of those individuals that your income exceeds a certain threshold that Medicare has put out there, and you'll get I'm going to also touch into that in a little bit here also. So if you have a higher income, there is a possibility that you may pay more. Okay, and here it is.
Simon,
Yes,
sorry
ma'am.
to interrupt. Just so you know, we have about 5 minutes, so I'm not
Okay.
sure if we'll have any extra questions, but we do want to hopefully have time for those.
Okay.
Thank
Okay.
you.
I'm going to skip through some of these again, just to be able to get to what the information that I needed to get you. Okay. Just a moment. I apologize for that. Sometimes I do get a little bit wordy. The Medigap policies.
I think we
Medigap
actually went
policies
over
again.
some of that anyway. So
I'm sorry, we did, right? I'm sorry.
yeah, some of that information you've already went over, so we're
Yes,
good.
yes. Okay, good. Thank you. This is the main thing with those Medigap policies. Let me get through this. Sorry about that. As far as the Medicare drug plans, again, just to reiterate with you, Medicare has subcontract with several private or commercial insurances that you can call, and they offer the standalone prescription drug plans. And again, you can go to the Medicare.gov website, which is very important, okay? The Medicare.gov website that you can go to, and they have a listing there of the drug plans that are available to you that you can utilize to cover your prescription drug plan. And again, Part D goes with original Medicare A and B and the standalone prescription drug plan. But if you go with a Medicare Advantage plan, remember the Part D coverage is already part of that. So you want to get into a Medicare Advantage plan with prescription drug coverage. I'm going to move along here real quick, okay? And again, remember, like I was telling you, sometimes we're in some key points. Medicare is a health insurance program. Medicare doesn't cover all of your healthcare costs. You have choices in how you get your coverage, and decisions affect the type of coverage that you get. Certain decisions are time sensitive, and that's why you have the different enrollment periods. And there are programs for people with limited income and resources that help you take care of that. And again, who are we? Again, we are the Area Agency on Aging. We are CHIP. A lot of individuals or a lot of the companies, Medicare refers to us as CHIP. We are the State Health Insurance Assistance Program. And again, we're out of with the Area Agency on Aging. These are the names of several individuals that also are on our team as far as benefit counselors. Melinda Gardner is our wonderful supervisor. Leslie Kilton is one of our benefits counselors. Dolores Purvis is another one of our counselors. And Felicia Warner is a third one. And then I am the fourth one. And again, my name is Simon Manrique. And there's our extension. You can call our toll-free number, 800-272-3921 to get our services. And our services are free to, we do not charge anything for any of our services. Again, like I was saying, CHIP is a federally funded program, and that CHIP stands for the State Health Insurance System Program. And that's it. And thank you so much for your attention. Y'all have a great afternoon and have a great rest of the week, okay? Be safe. I'm going to stop sharing.
Thank you. Thank you very much, Simon, for that information. Medicare is very confusing, and I know there were some questions in the chat. I think I answered most of them. I did share the slide presentation in the chat. Please let me know if that did not come through. And there was one question in reference to Medicare enrollment after 65. And I know you did touch on that. As long as someone has creditable coverage, usually through an employer, then they're able to sign up for Medicare without penalty. So you can find that information also in the Medicare and You handbook. A lot of this information, except for the amounts, are in the Medicare and You handbook. If you don't have one, you can definitely give us a call and we will be able to get one sent to you. Thank you very much for joining us, and thank you, Sharon, for allowing us to present.
Thank you, Simon and Melinda. And to our attendees, have an excellent evening.